talk about that all the time. Cleaning of flat surfaces regularly. And then social distancing, the physical distancing of 6 feet between us and others is important and something we ought to be cognizant of and try to do. And if you can't do that, then absolutely you should be wearing a mask. And so those efforts by many around the state has been helping us turn the tide on the growing epidemic and pandemic of the coronavirus and slow down the case increases. So one of the things that I've appreciated is I'm seeing more and more people that are wearing the mask, wearing a face covering, are cognizant of it, are concerned about it. And that's happening throughout the state, not just where it's mandated, but throughout all 29 counties of our state. More and more people are recognizing the importance of wearing a mask, and I appreciate that. More private sector, the stores are now requiring it of their own volition, saying, if you're going to shop inside our store, we require and request that you wear a mask. And so more and more people are realizing the significant medical advice that we've received here and are following that advice. Interestingly enough, our health department is in the process of working with other states and doing a scientific study just to evaluate what the percentage of people out there are in fact using face coverings, wearing a mask. And as we do this, it's really kind of a poll approach with in conjunction with other states. We find that 55% of the respondents say that they usually wear a mask, and 25% say that they always wear a mask when they cannot social distance. So that totals up to be about 80% of our population now that are in fact wearing the mask at least most of the time when they're out and about. And now we also have done not only the polling, but now we have people out there that are observers, and we don't think the observations actually justify 80%, but it's probably closer to 70% of people that are actually out there wearing masks throughout the state. And so I appreciate the good effort. It's helped us to turn the tide on the case rates, but I believe we actually can do better, and we need to do better, and there's certainly room for improvement. Now, we're all distracted, I think, a little bit by the shrill voices out there. We have people out there that are shrill voices say we should not shut down everything should be wide open, just like we were back in last January. We have others that are saying, you know, that the COVID-19 is just a hoax. It really isn't true, and somebody's making this up. Those extremes are what we ought not to listen to. The common sense, practical aspects of all of us, regardless of political persuasion, should in fact hold sway as we work together. I'm concerned about having the appropriate balance. I've said time and time again of making sure what we do helps protect people's lives, but also protects their livelihoods. And again, it's really about outcomes more than anything else. It should not be politicized, but we should work together in a spirit of collaboration and cooperation to make sure we have a low fatality rate, which we have done better than any state in America, that we have a growing, recovering economy. And at 5.1% unemployment rate in the state of Utah, we are the second lowest unemployment rate in the nation. I heard today on the news that we have our those who are applying for unemployment insurance have dropped dramatically over the last few weeks. So those are good signs that we're getting the appropriate and proper outcome. On that this issue, let me just say, I'm a local control person. I come from local government. I understand where the rubber meets the road. I understand the regional differences that we have throughout the state. I understand that we all have a rejection of a one-size-fits-all. Respective counties don't like to have one county telling them what to do or vice versa. They've been elected by those local people and they feel like that's their responsibility. So I appreciate and believe in local control, not only of our elected officials, but also of our local health departments working in concert with our state health department. Those are the ones that should be making the policy around our 13 regions of health in the state of Utah, and making decisions on what we should be doing as proper protocol to help us, in fact, protect the health and welfare of the people that they represent. As you know, in the past, we've in fact allowed local governments to in fact go through a process that allows them, if they, for example, want to mandate that masks are worn in their community, there was a process you could go through. We're going to streamline that process today, and for those who are in local government, if you want to opt into that program, if you want to say, we want to in our city or our county to have a mandate for masks, all you need to do is notify us. It'll make it a little easier, more streamlined. And we know right now we have 3 counties and a couple of cities that have done it. We know others are thinking about it. If they want to take that step with their local elected officials making that decision, they just need to notify our state health department, and it will be so ordered that you're allowed to, in fact, have a mandate for face coverings in your respective local government. So again, that's local control. Again, we have a lot yet still to do. We're not ready to spike the football, but we do think that there's some opportunities for us, in fact, to do better. We got down to 500, so that was a challenge that we all accepted and worked together and succeeded in obtaining that goal of less than 500. But we are time for a new challenge, and that is, I'd like to, in fact, set a new goal. And that would be to have our cases below 400 by September the 1st, and have a rolling day, 7-day average of 400 cases or less by September 1st. Again, that's something I think if we all work together, we can do this. We need to do it. And I think it's a new challenge, a new goal, a new opportunity for us, in fact, to continue to dampen the spread of this coronavirus. So with that, I'm going to turn now some time over to Dr. Dunn to give our regular update, our case counts, and some health guidance that we're using for education, some clarifications there. And she'll be followed by my education advisor, Tammy Piper. So we'll go to that point.
Hey, good afternoon. We now have a total of 42,915 COVID-19 cases diagnosed in Utah. That's a 7-day rolling average of 449, as we heard from Governor Herbert, and it's a decrease from last week. Last week, we were at an average of 508 daily cases. More than 550,000 individuals have been tested for COVID-19. Our percent positivity 7-day rolling average is now at 10%. That's a slight increase from last week. We were at 9.6%. We have a total of 330 deaths due to COVID-19 in Utah. That is an increase of 3 from yesterday. I'm really encouraged with the progress we've made in this pandemic in Utah. We have seen an overall decline in daily cases that started around July 22nd. And this is a reflection of Utah residents caring about each other and their community to keep everyone safe. We are all depending on each other to continue wearing face masks, staying home when we're ill, practicing physical distancing, and using good hand hygiene. These measures work, and we all need to continue doing them to open up schools safely, engage more in the economy, and stay healthy. So I want to talk about schools for a moment. Last week, we released a COVID-19 school manual with information for students, teachers, parents, and schools. The purpose of this manual is to provide recommendations on how to safely operate schools in the fall. Schools and parents are not required to follow any of these recommendations, but it does serve as a blueprint for schools as they make important decisions on how to safely reopen. Ultimately, school districts are determining how and if they will implement these recommendations. And I encourage parents to reach out to their school districts and look at their district's plans as they're making their own personal decisions about their kids returning to school. The State Health Department, Utah's 13 local health districts, and the Utah State Board of Education have received a lot of input since releasing the manual last week, and we've listened to that feedback. Today, we're making some changes to the manual that are still consistent with good public health practice. So with regards to modified quarantine, we are removing the recommendation that students and teachers be allowed to attend school while they're on quarantine. Instead, we recommend that students and teachers follow standard quarantine practices and procedures. This means that anytime somebody has close contact with a confirmed case of COVID-19, That means they've been within 6 feet for 15 minutes or more of a confirmed case. That person should spend their entire 14-day quarantine period at home, not attend school, and not participate in extracurricular activities. Everybody wants to make sure that teachers, parents, and students feel safe and are safe as they return to school. The prevention measures we all take, wearing face masks, practicing physical distancing, staying home when we're ill, and using good hand hygiene, will help us open up schools safely and keep them open. Thank you.
Hello, my name is Tammy Pfeiffer, and I'm the Governor's Education Policy Advisor. I'm honored to be here with you today. And I appreciate the Governor allowing me to take just a few minutes to share some of the thoughts on what we are seeing as schools prepare to make plans for a new school year. I first want to acknowledge the hundreds of parents, teachers, school staff, and community members who have taken the time to contact our office via email, phone calls, texts, and letters. We appreciate you taking the time to share your thoughts with us. And as we have read your emails and seen posts on social media, we've worked to understand your fears and concerns. As the Governor noted in his remarks a few weeks ago, there's a great deal of uncertainty right now about how we can go about safely reopening our schools. And uncertainty can lead to fear, and fear sometimes turns to anger and division. I echo his call for patience and for grace in our interactions with one another. McKay Jensen, a local school board member who is grappling with the difficult decision of how to reopen their district school safely, said recently that while we want to deal in absolutes, we're being called upon right now instead to do our best with uncertainty. So today I want to share this message about uncertainty. Amid all of this uncertainty, there are a few things that we are certain of. First, a few months ago, we watched as our educators pivoted in just a matter of days from in-person to online instruction. They were widely praised as heroes. And at the same time, we saw our parents who had to juggle working at home while sitting alongside their children for hours at a time, helping them complete assignments and explain math problems. Educators praised the work of our parents as they watched them take on all of these new responsibilities. There was a feeling a few months ago that we were in this together, that we were united for the sake of our students. As that early sprint has now become a marathon, I worry that some of this feeling of unity has begun to unravel. We are hearing educators labeled as lazy and paranoid. Parents are being characterized as callous and selfish, and policymakers are being called uncaring. This is wrong. The first thing that is certain is that we are still in this together. We must be in this together. We still all care about our students, and we still all need each other in order to make teaching and learning successful this fall. Governor Herbert's mantra for the past several years, which I have so appreciated, has been to unite and focus. We must continue to unite. Second, we are certain that there are no easy answers. A school board member said to us recently, I could argue every side of this, from doing all remote learning to having students return to the classroom 5 days a week. Our school boards and charter boards have been asked to do the impossible. Local and state education leaders are feeling the weight of complex problems with seemingly impossible solutions. There is no one-size-fits-all educational approach when it comes to reopening our schools across the state. Context matters in each one of our communities. We are certain that our charter and school boards want to be responsive to their constituents, to support their educators and their staff, and to ultimately do what is best for our students. We want to thank them for being thoughtful, for the sleepless nights they've spent thinking about these issues, for the hours they've spent reading and responding to email, and for their creativity in thinking about different options. Please continue to provide your local charter and school board members with your input, but also understand that if they make a decision that's different than what you've proposed, it doesn't mean that they've disregarded or have not heard your opinion. Just realize that there are a lot of viewpoints that are being expressed at this time that they are being asked to balance. We are certain that whatever decisions are made this week by school boards and charter boards are not going to be the last decisions that they are making as the situation continues to change and evolve. So let's model the problem-solving behavior that we want to see from our students and our own children when they feel frustrated, upset, or afraid. We are certain that they are watching us. We are certain that educators are key to a robust education system. They contribute not only to the academic success of our students, but to their social and emotional well-being. We must provide safe working environments for our educators as we return to in-person instruction. Finally, we are certain that if we choose unity over division, we can move forward in ways that benefit our students, their parents, the families, our staff, and our community. This is hard. It's incredibly hard work. And as a community, we're grappling collectively with one of the most difficult situations that any one of us has ever faced. But we're certain that we can do this. We can choose how we respond and how these challenges shape us. I want to leave you with these words from our students. This is a group of student body presidents from Utah high schools who last April put together a video called Rise Together. It was designed at the time to encourage their classmates as they were experiencing loss and uncertainty during those final weeks of their senior year. I felt like their messages were timely and instructive for us. They included the following. Together means we are all in this together. We can overcome this. Believe in a unified Utah. Keep pushing forward. And finally, let's rise together and stand as one. Thank you.
Well, thank you, Dr. Dunn and Tammy. We appreciate the good work you're both are doing as our state epidemiologist and as our education policy advisor. Those are difficult positions, as you can appreciate today with the pandemic raging. Let me just make a few final points, if I could, here before we'll open it up for some questions. One, we are very eager to have schools to open up and our kids get back to school and to learn and prepare themselves for citizenship and for the responsibilities that come with adulthood and opportunities in a free market system that we really cherish here in the state of Utah, which we've been so successful at. Education is a key to people's success in life. No matter where you come from or what your background is, a good education will lift you up to better and greater heights. So we're very eager to have our children back in the classroom, but we want them to be back in a classroom that's safe. We're also eager to have our teachers to be there in an environment that's safe for teachers too. And not just the students and the teachers, but the principals, the faculty members, the janitors, the bus drivers, everybody associated with our school system has a right to expect that they're going to go back to a safe environment where they can function properly. Parents have a right to expect their children to go to a safe environment. And so we appreciate the work that's being done by so many to ensure that that, in fact, is the outcome and the case through our 41 different school districts. Local school boards do have the authority to make the plan and decide what the plan should be to reopen. That's being done in conjunction with our local health departments to make sure that certain protocols are followed and that decisions are being made with that goal of having a safe environment upmost in people's minds as they develop the plans. I want to make sure it's clear that I have not ordered our schools to be open. That's a local responsibility. I've talked in terms of hope that the schools will open. I've talked in terms of expecting schools to open in some form or fashion. But these are local decisions, and how they decide to open is their plan. And how they decide to reopen is something that might be unique to the local school districts and not the same in all 41 throughout the state for obvious reasons. How they do it safely, that's a determination they need to work with the local health departments. And we're not requiring any school to open in any particular certain way. There's probably a variety of ways to do it, and we're seeing that those plans emerge, that there are, in fact, a lot of different approaches being taken. We want to make sure that in that process that parents have opportunities of choice, that they can make sure that they feel comfortable about what the education is going to be like, how it's going to be conducted, and that their children will be in a safe environment. And so we certainly want them to be involved and give input and weigh and consider what their risk factor may be for their family if their children go to school. Every school district has, as I understand it, and should have, some ability for online learning, so people can, in fact, have distance learning if they don't feel comfortable in going to school. So choices and flexibility are of utmost importance at this particular time, particularly for parents and children. As well, I would say, add for the teachers. And we're working with the teachers and their situation, their concerns, and working with our local school districts and the state school board, as well as health departments, to make sure that we can answer some of the concerns teachers have as part of the protocol going forward. I'm confident we can work those out and have openings, maybe a variety of different kinds of openings, but still get back to instructing our young people and preparing them for getting a good education and becoming good citizens and post public education opportunities in the marketplace. Second, I want to talk about something that's been of a concern for some of our teachers, and that's personal protection equipment. We're aware that teachers are concerned about where do we get it, are we going to have it? And our state's been very good and diligent in making sure we have a supply of personal protective equipment. Under our unified command, in fact, we found ways of acquiring that. The supply group that we have under our unified command has made sure we have ample supply of KN95 masks and face shields that will be available to all teachers, staff, bus drivers, janitors, anybody involved with the school system will have access to masks and face shields. The state's distribution center will put together a one-time, what they call PPE push packs for every school district, so that they'll have a supply of these. As the districts work to secure their own supply, the state will in fact backfill to make sure that they have access to PPEs. This pack will include 5 KN95 masks and 2 face shields for every teacher and faculty member. That equals 250,000 KN95 masks and 100,000 face shields that the distribution center here in the state will push out. We would anticipate in doing so that we'll support approximately 28,000 teachers and 16,000 staff. Third, I want to mention we've decided to team up with 7 other states with the Rockefeller Foundation. Again, having concerns with testing and making sure that our testing improves, not only the quality of the testing, but accessibility, cost, and time of lab tests to turn around the results. I've been invited by Maryland Governor Larry Hogan, a good friend of mine, who's partnered with the Rockefeller Foundation to work on purchasing and deploying large amounts of rapid COVID-19 tests. These are tests, once they are in place, will be able to have results in 20 or 30 minutes. So very rapid testing, and we appreciate the opportunity to work with the Rockefeller Foundation and again, Governor Hogan from Maryland, who's invited us to join with them. This compact is in the very early stages of being completed and working together. Some media have already got some information on this, so I wanted to clarify what's taking place, and we'll have more to talk about that in the next coming days. We're confident this will allow us, in fact, to help with all the other protocols we've got in place to slow down the spread of the coronavirus. Last but not least, let me just say, we ought to give a shout out to those involved in the healthcare industry. This has not been an easy time for them either. They're overworked. They have, it's a kind of a life or death situation that they feel that pressure. And I've had the opportunity to visit with ICU, in the ICU of Intermountain Healthcare, rather. as well as other of our hospital associations around the state. And they deserve our thanks and gratitude for the work that they're doing on the front lines of this pandemic. They are heroes, and they show up to work every day and put on their face masks and their shields and deal with people in difficult circumstances to make them work, get them better and get back to work. And one of the reasons we're having such great success in recovery and low mortality rates is because the people working in our hospitals and our medical offices, those involved in the healthcare system. So we thank them. Part of the work of getting down below 500 has been because of the work that they've done also. So let me just say in conclusion that, as Tammy mentioned, it really is a matter of us working together. As we all work together, we'll be able to have continued success. What that does too, by the way, is provide consumer confidence. People feel good about going to places and seeing the spread slow down. People taking this seriously, wearing of the mask is a sign that I care. I'm doing my part. And as we have increased consumer confidence, the economy will continue to grow and expand, which is what we want to, in fact, have happen. People will get able to go back to their work, get their jobs, and get back to some normalcy, at least when it comes to economic opportunity. So it works hand in hand. These are not mutually exclusive ideas. We have a lot of talk about liberty. And I understand freedom and liberty is first and foremost what's made America great. But I also understand that liberty needs to be coupled with, in fact, individual responsibility. We have a responsibility to be good citizens, to take care of each other, to help where we can, to do our part. We can't do everything, but we can do something. So I would encourage all of us to be good citizens, to do our part. We are in this together, and together we can, in fact, conquer this pandemic and get Utah back on the normal stages that we had here just a few months ago. And I appreciate the work that's being done to do that today, and we're in a good place, and I hope that by next month we'll be in a better place. With that, we'll open it up for any questions you might have, and Dr. Dunn is here, as well as Tammy, to talk about education issues if we have those, but we'll open it up for a few minutes.
Hi there, Governor. This is Chris Reed with St. George News. You mentioned about local districts having, you're about local control, local districts having a jurisdiction, and that the pandemic plan, school plan is a guide. But can school districts still opt for a modified quarantine, allowing people who've been exposed to the virus to come to school if they want to? And can they even request that masks not be worn?
Well, it's a collaborative effort between not only the school boards, but the local health department, empowered by the state health department. For example, we've made it as a mandate that people have to wear masks when they go to school. Our students have to wear masks. Certainly, if they don't social distance, so they can't get the physical distance of 6 feet, they've got to wear masks. We understand that there might be some few exceptions that might, for a health reason, some other concern, disability, et cetera, that maybe would be exempted from wearing a face covering. But that will be few and far between, I expect. But those are decisions that are made at the local level as far as what's the protocol. For example, do we delay the opening? Do we just do online to begin with, or do we delay having in-class face-to-face instruction until after Labor Day? Some are considering doing that. That's a local decision to be made. Some schools have much more crowded classrooms than other school districts. And so the ability to social distance, to have physical distance between desks, is easier in some schools than in others. That's a local jurisdiction decision to be made. Again, in conjunction with health care, to make sure that if we have to quarantine, how do we do it? What is the process to quarantine student or teachers if somebody comes down sick? We have guidelines that have been put in place, which again, the health department will make sure are being enforced with the plans with our local school districts. So it's really a collaborative effort. The authority to do these things comes from the state legislature, empowering the health departments to do these kinds of make tough decisions and empower them by legislation. So again, I expect it's really all of us working together. There's some uncertainty out there. All plans are not going to be the same, but we'll work through this and navigate it together, and we're going to come out all right.
Hi, Governor. It's Ben Winslow with Fox 13. I wanted to ask about your deferring to local governments when it comes to issuing their own mask requirements. So essentially, if I understand what you're proposing or what you're planning is that they no longer have to say, Governor, may I? They can just go ahead and implement it and say, hey, by the way, we've implemented this?
Yeah, I'd probably call it more of a kind of an opt-in. We've set the precedent already that there's not really any reason to not grant that request. I am a local control person. I understand that those folks know their politics, they know their culture, they know the situation as well as anybody on hand. And so rather than somebody from afar mandate and dictate to them, I've put the responsibility on those local elected officials. And if they want to do something, if they, the one that keeps coming up all the time, but there's probably more than this, by the way, but it comes up as the face, mandating the face mask. So if they want to do that, all they need to do is notify us and they'll opt into that opportunity and it's just automatic.
So does this negate the idea of a statewide mandate? Does this just put that to rest, that there will be no statewide mandate?
No, one of the tools in the toolbox is in fact a more aggressive approach from the state government. Again, I would hope that we don't have to do that. Again, I mentioned just a bit ago here about, I understand freedom and liberty and people's arguments about that, but also understand individual responsibility and the responsibility we all have to do our part to help our neighbor. This is a pandemic. This is not a joke. This is a serious issue that people are dying from and getting sick. So rather than argue over the merits of whether it should be done by a mandate, whether it's statewide or by a local government, why don't we just do it? Because it's good counsel, it's good medicine. Do it because it's the right thing to do. As I've said so many times, it's becoming a cliche. That being said, we've set a new goal down to 400 by September 1st. If we see spiking that takes place, if we go the other direction, that may prompt a review of a statewide mandate. That certainly is still a tool in the toolbox to be used, if necessary.
Hi, this is Haley Hendricks with ABC4 News. Question for Dr. Dunn.
Go ahead.
Dr. Dunn, so what was the reason for the modification in the quarantine guidelines when it comes to students, staff, and teachers?
Sorry, so can you say that again? What was the reason for what?
The modification in the quarantine guidelines when it comes to students, staff, and teachers at schools?
Sure. So the original manual that we put out last week followed public health guidance with regards to quarantine for employees in essential industries. And so we felt like it was responsible to allow students and teachers who were on quarantine but had no symptoms to attend school if they were able to wear a face covering and practice social distancing. You know, we got a lot of feedback from stakeholders that weren't comfortable with that. And so we are willing to adjust and provide a more strict recommendation, which is the traditional quarantine, where anybody who has come into close contact with a confirmed case does have to stay home for 14 days.
Okay, so do you guys feel like there is going to be issues come this fall with schools reopening and students being placed on quarantine? Does that appear to be possibly an issue that you guys are concerned about?
Yeah, I mean, of course, I mean, everything we're trying to do is balance keeping kids in school safely with also preventing the spread of COVID-19. So we'll have to see how this plays out and how quarantine at home for 14 days impacts the flow of in-person education. And we'll also learn a lot more in terms of transmission of COVID-19 in the school setting and the true risks around that. There's just so much we don't know right now. But again, this is an evolving process, and that manual is certainly a living document. So as we learn more and as we progress through the fall with schools, we will certainly watch it closely and see if we need to modify that.
Absolutely. Thank you so much.
Sure.
Next question.
Hello, Governor Brian Malahy from Channel 2. How are you?
Good, Brian. How are you?
Good, doing well. A couple of questions for you. First, you want schools reopening to be local control. You said that you don't have, at least been reported, that you don't have the authority to force them to reopen, but you did shut them down. So can you explain why you have the authority to close but not the authority to reopen? And second, were you, as was reported, frustrated with the UEA's position regarding schools reopening?
Well, on the first question, that was done in conjunction with the state health department and in conjunction with the state school board. And so it was not just me unilaterally saying we're going to stop. It was really a collaborative effort with the power of that coming from the state school board and the health department. That's where the authorization comes from. I do have emergency powers under a state of emergency. Those come and go based on a state of emergency. So I did have the power in that particular circumstance, but it was all three of us working together in concert. The second question was frustration with the UEA. Was that, say it again, Brian? Do we lose him?
Can you hear me now?
Yes, go ahead, Brian. The second, it's about the UEA.
Yeah, it was reported that you were frustrated with the UEA's position regarding reopening at least some schools. Is that true? And if so, what was the source of your frustration?
Well, it's not true. Again, I've heard that it's been reported that by somebody who was in a meeting that evidently I wasn't in. At least my recollection of what took place there was not one of frustration. It was one of wanting to have specifics. We appreciate the teachers and the work they're doing. There is nobody that's more respected in our society than teachers. They do a great work. They're the foundation for what society becomes as they teach our young people to be responsible citizens, teach them the education skills they need to have to compete in the marketplace. We can't say enough about our teachers. As we had the meeting that I think you're referencing, we get a lot of input. I mean, gee, every day we get hundreds of emails and suggestions from people. Some of them are good, some of them not so good. But the teachers, we're concerned about making sure that they feel good about coming to school. And so the question we had for the UEA when they came was, we need more specifics. What is it specifically that you want to see take place for us to be able to open up the schools in some form or fashion? They've gone back since that meeting, by the way. I've drafted up more detail on 5 different component areas and subheadings of that issue, which we're working with our state health department, our local health departments, as well as I've given copies to the legislature to see if we can, in fact, find that appropriate optimal place that we need to be to open up schools. So I don't think frustration is the right term. It sounds like I was a little bit angry. I was not. I was actually pleased to have them at the table and all of us sitting around the table discussing and finding a solution. But we certainly needed to have some specifics. It can't be just a general, we want things better. What do you mean by wanting things better? And they've stepped up to do that. I met with them just again yesterday, and they gave me their detailed information, and we're going to see what we can do to, in fact, incorporate some of that into the plans. Next question.
Hi, can you hear me?
Yes, Aaron, go ahead.
Thank you. This is actually a question for Dr. Dunn. I know we've seen the case numbers go down, but we've also seen the numbers of people being tested go down so sharply that the percent positive has risen during the same time period where the number of cases was going down. So my question is, why are fewer people being tested? And if demand is down, what might be the reason for that? And 2, could the decline in tests coupled with this increase in the rate of positive results suggest that there's actually a bigger spread going on, but those cases aren't being counted?
Yeah, we definitely are cautiously optimistic about our decline because of the decrease in testing demand. The reasons, we've spoken with all of our healthcare systems and specimen collection sites. It is consistent across the state. Every jurisdiction is seeing a decline in testing. Every specimen collection site is seeing a decline in testing. So it is truly a demand issue. It could be because people just aren't sick and they don't have symptoms. It's been really hot out. People have to wait outside. There's a bunch of reasons why we could kind of hypothesize why testing is down. We do want to emphasize, though, that if you are a close contact of a confirmed case, we urge you to get tested about 7 days after your exposure so that we can identify pre-symptomatic disease and prevent spread that way. So it is up to all of us to really seek out testing when we have any of the most mild symptoms or if we're a close contact. And certainly going through your local public health department to get that referral will be essential. It is true that, we do want to see a decrease in the percent positivity. That gives us even more confidence that we have this under control. So really getting more people out there and getting tested with mild symptoms or if they're a close contact is going to be key to that.
Thank you.
All right, we'll take one last question.
Yeah, hi, Paul Nelson with KSL News Radio. Kind of on those testing numbers, there have been some writers and even some high-profile political figures that have made the claim that the reason why Utah even got down to a rolling average of 500 was because the testing was being deliberately restricted or even manipulated in some way. Would either of you, either Dr. Dunn or the governor, how do you respond to those?
Well, I'll have Dr. Dunn add to that. She's the epidemiologist, and she knows all the inner workings of how we do the testing and the numbers. But that's just patently false. Nobody's jimmying any numbers. The numbers are what the numbers are. We recognize that we want to have more testing to be done. We don't exactly know why fewer people are getting tested. We've made accommodations so that those testing numbers can stay up. And certainly it's a reflection of the testing, the numbers we do as far as what the case counts are. Our decisions on what we do, on restrictions, on the color codes that we have out there for the plan to get us back on track, have to do with a lot more things than just, the case numbers. And our unified command, they meet every day to look at all the numbers and the data to make decisions on what we should be doing, proceeding going forward. So I can just tell you absolutely patently false that there's any manipulating of numbers. Dr. Dunn?
Yeah, I agree with Governor Herbert. There is definitely no manipulation of numbers or suppressing of people being able to get tested. At our peak of testing, we were around 6,000 to 8,000 people a day, and now we're back to 3,000 to 5,000 a day, and that's where we were a couple months ago. It's still a really good number of people being tested every day. So it's lower than our peak, but it's still a really good number moving forward. So it does give us appropriate, cautious optimism that our numbers are declining. But at the Department of Health, we have the utmost integrity and would never do anything to manipulate numbers in any way, especially during a pandemic. So those rumors are false.
Well, thank you. Let me just, in conclusion, thank everybody. Again, we've had some good news. We still have a significant challenge and a tough road to hoe to get to where we need to be by the end of this year. I think as we work together, we can do it. I'm optimistic. I've always been optimistic. I believe in the people of Utah to do the right thing for the right reasons. But we all have a part to play. And so let's not become complacent. Hey, we've got it down below 500. The goal is to get down below 400. It's a new goal. But let's not lower our guard. Let's wear the mask. Let's do the social distancing. Let's do all we can to do our part to slow down the spread and stop the spread of the coronavirus and make sure that Utah continues to perform at its peak capabilities. We can do that if we work together. Thank you very much.
Thank you to Governor Herbert and our other speakers. Please remember that you have great information always available to you at coronavirus.utah.gov. There's information there in English and in Spanish. We also want to thank our friends in the media for reporting today, our interpreters in Spanish and in American Sign Language. We will talk to you next week.